Last month, the state committed to investing $56 million to combat food insecurity in Massachusetts, a problem that has been made worse during the new coronavirus. I spoke with Terry Maxey, the director of Open Pantry Community Services, Inc., about that funding, how its services are being used by community members, and more.
I think it's something that is truly needed. As you know, with unemployment and some of the challenges we are having in our community and across the country, the demand for food has increased. We're dealing with food insecurities, and this is very well seen as an opportunity to help those unfortunate and those that are in need.
Can you give us a sense of what the demand has been like there at Open Pantry? I think I read on your website that you distributed somewhere in the realm of 1 million pounds of food last year, but what's demand been like in these last few months with COVID-19?
What we're seeing is a pretty steady flow of clients looking for food. One of the things that we have identified is that the majority of the folks that are coming in are new clients to our food pantry. So you're looking at approximately 40% of the population that are coming now are new people looking for food.
And do you know if they're using that to sort of bridge the gap between maybe unemployment checks, or do you collect data in that way, or do they speak with you about that?
No, our process is that they'll come in and do an intake and show a proof of residency. So we don't necessarily get into if they're receiving food stamps. What we're trying to do is just address the demand.
Understood. Absolutely. And as I understand how the system works there at Open Pantry, typically in non-COVID times, families are allowed to access the food pantry 6 times a year, and seniors are allowed 12 times a year. Is that correct?
Yes. Our seniors program is it's every third Monday of the month. So yes, it is 12 times a year, every third Monday, and then our clients have their ability to access it as well.
Have you looked at whether you might need to or will be able to expand those offerings, or do you need to stick with what you typically are able to offer the public?
Yeah, currently we'll probably stick with what we can offer to the public, but we do realize that there will be a demand, and one of our concerns is that will this demand continue? If that is the case, then we distribute more than 1 million pounds last year. We will far exceed that this year.
With this influx of money expected to be coming from the state, do you know how much Open Pantry might receive?
No, I don't.
Still waiting to hear on that one.
Yes.
With the Loaves and Fishes Community Kitchen, that's typically a food service that you provide to people. Have you been able to continue that during COVID-19, where social distancing is so important?
Yes, our prepared meat food program at Loaves and Fishes, what we're doing is we are offering meals to go. So we're not, as you know, social distancing is very important to combat this pandemic. And with what we're doing with our Loaves and Fishes, that we are setting up in the parking lot, so which gives us the opportunity and our population opportunity to adhere to that social distancing.
Something else I read in Mass Live with respect to this new $56 million coming from the state is that $12 million will be invested to provide family food boxes that, according to this article, will be distributed through food pantries. Is it clear how that program's going to work, or is it still something that you are going to be learning about and will be developing here in the weeks that we are following?
Yeah, it's something that we will be developing. We have not received any direction from the food bank of Western Mass, so we're looking for some guidance there, and at that point, we'll determine the direction we'll go. As
you've watched how this has impacted the clients who you serve, what has really been sticking with you?
The thing that stands out the most is the appreciation that they have for what we're doing. And, and many times, we'll hear our clients say something like, thank you, we were on our last dollar or last stamp, and this is truly going to help put food on the table. And to see the children that often come with them is it's very rewarding to see that we're doing something for a population that needs our help.
Let's talk about some of the other services that the food pantry offers, whether it's the teen parenting program, Tranquility House, the parent program. What's the status of these other programs that typically are well used by members of our community?
So our teen parent program, which is located in the north end of Springfield, has been functioning as they would normally function. The only difference that we put in place is that there are no visitors. Other than that, we're steadfast with our current operation, and things are going well. The other programs, we have Open Door Social Services, which is we're under contract with the Health and Human Services for the homeless, located on the corner of State and School Street. We are offering telehealth support for our clients, as well as mail distribution, which is part of our contract.
The homeless population, specifically in Springfield, was promised that the COVID-19 testing would be made available, and then there was some controversy over whether or not those tests were being administered. Can you give us an update or what you know about that process?
My understanding is that if there's anyone that has been exposed to the COVID virus, they had the opportunity to go to the tent, which is outside of FOH, and be tested. And whatever the results of the testing, then they'll provide whatever services, support that they need. What we're doing is our case managers are directing any clients that they are in contact with through our telehealth that have concerns. We would direct them to the tent that's in the parking lot outside of FOH, Friends of the Homeless.
Terry, for you as director of Open Pantry, what do you think needs attention right now that maybe isn't getting it or isn't being talked about enough?
I think making sure that we get the supportive services for our substance use clients that are out there, the mental health, and as well as our staff. You know, our staff is under tremendous stress, and they are trying to provide the best possible service to our population, and without being able to meet with them personally, sometimes makes that very challenging.
To your point, your staff members, how are you doing in terms of being an organization? Have you had to lay off people, or have you been able to keep all of your staff members?
No, we're not furloughing anyone. No, everyone is working. We have not furloughed anyone, and we do not plan on furloughing anyone in the agency.